Good evening. Thanks for always staying with Lagos Television. You're watching Soundhealth. I am Olasumbo Modupe. Today on the program, we are taking a look at the Multiple Indicator Cluster Survey 6, recently launched by the UNICEF. And our focus especially is on maternal, adolescent, and child health. The conversation begins after this break. Please stay tuned.
The COVID-19 pandemic has increased how societies value health. We have never been so aware of government actions to protect our health and well-being. Yet, too often, people's insights and lived experiences remained unheard in government decision-making. Governments must make a targeted effort to change this. Amplifying people's voices in health policy making by using participatory spaces as part of decision-making processes is the way forward. If these spaces are well designed and used regularly, they have a transformative potential to become a potent tool for more responsive and implementable policies. There are many ways governments can engage with the population to capture their needs. Mechanisms such as open forums, citizen juries, consultative meetings, and district health committees with fixed seats for civic and community groups are all methods of engagement. But government resources and capacities are too often lacking to manage these spaces effectively. The WHO Handbook on Social Participation for UHC provides practical guidance for policymakers to engage with the population by creating, strengthening, and sustaining participatory spaces. Policymakers must learn how to design spaces to empower people to express themselves frankly.
It is still Sound Health on Lagos Television. Joining us via Zoom this evening is Dr. Ijeoma Agbo, UNICEF health specialist, and she's going to take us through the recently released Multiple Indicator Cluster Survey 6. Good evening, Dr. Agbo, and thanks for joining us.
Good evening, and thanks for having me.
All right, Dr. Agbo, quickly take us through what the Multiple Indicator Cluster Survey 6 is all about.
Okay, so thanks so much for your question. The Nigerian Multiple Indicator Cluster Survey was conducted by the National Bureau of Statistics in 2021 as part of the Global Mixed Program with technical support from UNICEF as well as other partners. And it is designed to provide up-to-date, quality, statistically reliable data that can be used to assess the situation of children, adolescents, women, and households in Nigeria. Is also quite useful because it's here to give us data that we can use to plan and have what I call evidence-based planning of programs. And also, you can't have a plan, when you implement it, you need to monitor it, right? So we can also use this to monitor progress towards our national goals, also goals that we set at sub-national level as a basis for future action.
Okay, for the purpose of this program now, we are looking at just maternal, adolescent, and child health, because I understand the report is about 888 pages. So let's just focus on the health aspects now. If we are going to do an appraisal of the outcome, how has the country fared? And is it just for a particular geographical location?
So this survey was actually conducted at national level, and it was for the urban and rural areas across our 36 states and including the Federal Capital Territory. So it's actually used to assess our situation across the entire country. Narrowing down to maternal and child health, because this is not just we didn't just look at indicators for health, we looked at indicators across different program areas, because we're talking about health today. So looking at health, if you look at the results across the country, we can see that in the south, we've performed better than what we have in the north. But there's always room for improvement. We looked at indicators across different domains, reproductive health, there's child health, looked at our indicators across mortalities as well. So those are the indicators that we looked at. We also looked at fertility rates as well as the use of family planning. But going into what we have in the Southwest, I'll just take a few of the indicators. So for reproductive health, for instance, we looked at delivery in a health facility, delivery by skilled birth attendants, and postnatal care and all that. We can see in the South, we perform much better, and even better than the national indicators. For instance, in a delivery for a health facility across the Southwest, we had a Southwest average of about 79%. If we look at what we have at national level, it's 49%. So we can see that we're faring better in the Southwest. But it doesn't mean we need to relax with 90 and even 100. I would also like to look at within states in the Southwest. We found that certain states perform better. For instance, like Lagos, we perform better across most of the indicators. But for us as UNICEF, we like to focus not just on the coverage, but we look at the percentage, the population as well, because we want to ensure that every child at the last mile is reached, everybody is reached with essential interventions. And so whilst we're looking at the fact that in terms of coverage, we have coverages from 79 to 90%, we like to look at the absolute figures. Because when you look at a state like Lagos that has approximately 28 million people, those that are unreached, which is the 10% or the 12%, is actually high in number, and that is a cause for concern. And so this is where I say that the mix is quite beautiful, because then you can see that yes, you're doing better, but if you look at the absolute figures, there's still a lot that needs to be done. And the states have been party to the dissemination of these results and are using it to do deeper dives to understand what the situation is, what the enablers and the drivers for some of these poor coverages that they are seeing, and looking at ways to improve them.
Okay, another area of concern is postnatal care for newborn. Let's look at that area, and what are your thoughts? What do you think we can do to scale up in this area?
For postnatal care in newborn, and I'll speak for the Southwest where we are about 5%. If you look across the Southwest, the best state was 10%, which was in Ondo State. Lagos State was about 4% when it comes to postnatal care. And when I mean postnatal care, we have different ways of looking at it. We look at it within 1 day of birth, within 3 days, and we have up to 1 week. But we like to look at, within 3 days of birth, because we expect that when a child has been born, at least they should be assessed within 3 days. We find out that we don't exactly have very good coverage when it comes to that, and that is an area we need to work on. There are different reasons for this. It might be that people do not give birth. We have a high number of people who do not give birth in the health facilities, that give birth in TBAs at home and other mission homes and all that. So that might be a reason, because then they are not being captured in the facility, and then even in terms of follow-up, they do not come back for postnatal care. You find that the only time they might actually have to come to the facilities when they come for immunization. So this is an area that the states, as with support from UNICEF, that we're looking at working on how to raise awareness within communities, within the states, for women, once they've given birth, to come back within 3 days for their children to be checked. With this, we can allay a lot of the issues that we see in the newborn and nip it in the bud quite quickly before it becomes a severe issue.
Child mortality is another area of focus now. According to that survey, under 5 mortality was at 102 per 1,000. How do you think we can also improve in that area, and what do you think could be responsible for that, looking at efforts towards achieving the SDGs?
So just as you mentioned, the under 5 mortality in Nigeria presently stands at 102%. This is unacceptable, it's high. But when we look at across the different zones, for instance, in the Southwest, we're presently at about 48%, which is still unacceptable. But one thing we would like to look at is that we would like to look at the 4 different mortality rates: neonatal, infants, child mortality, and under 5 mortality. Reason being that it gives us an idea which particular age group is affected. So for instance, if you look at neonatal mortality is on 34%, and neonatal mortality means probability of dying in the first 30 days of life. For infant mortality, which is between birth and the first day of life, is about 63%. And when you look at child mortality, which is between 1 and 5 years, is 42. Under 5 is 1 or 2, as you mentioned. So you can see that most of the death is actually happening between infant stage and 5 years of age. So it shows where we need to focus a bit more of our work on. If you come down to a place like Lagos, you'll see that neonatal mortality is 11%. But when you look at your infant mortality and child mortality is 15%, as well as under 5%. So we can see that most of the problem is actually between the first and fifth year of life. So it's actually good to look at all the entire ranges of the mortality rate to understand where exactly we will put our interventions into. With this, we're now looking at what are the drivers for this. Is it around childbirth? Is it around the diseases that contribute to death in children, which is malaria, diarrhea, and pneumonia? Those are all the things that we're looking at to see what we need to do better. For us as a country, we're looking at, ensuring that the child, from the time the woman is pregnant, that she has skilled birth attendants in terms of delivery as well, to ensure that she has a safe delivery. Looking at the postnatal care to ensure that children are being cared for within the first days of life. And then looking at breastfeeding. So basically, we're just looking at all the interventions across the continuum of care so that we can ensure that we continue to take care of our children from the time that they are in their mom's womb up until 5 years of age. And that is why we continue to see UNICEF driving a lot of these interventions at PAC level to see that our children grow up optimally.
All right, this survey is not just out to, bring out any state's effort, but to let them know that highlight areas where they can actually work on. Let's look at immunization briefly now. We still have some states lagging behind in BCG administration, Penta 1, Penta 3, and measles. If we are to focus on measles alone, the World Health Organization says many children are even at risk now of getting infected with measles. How do you think we can also scale up in this area?
So thank you very much. Immunization is one of the core mandates of UNICEF. It's one of the cheapest ways by which we can prevent vaccine preventable diseases in our children. Whilst we have, basically we have a Penta 3 coverage at national level of 57%. But if you look at the Southwest, they're doing much better. They're about 69%. But we like to look at the fact that what's happening to the 31% that are unvaccinated. That means we have a pool of children who are susceptible to vaccine preventable diseases. Vis-a-vis TB, measles, and all that. And just as you mentioned rightly, because of that, we've been seeing across the country, we've been having pockets of outbreaks happening for measles within the country, and this is due to this suboptimal coverage that we've seen. So we continue to look at how we can support the government to improve immunization coverage within our states. And this ranges from improving access to health facilities where they can get immunization services for their children, and also improving demand amongst our caregivers. In terms of improving access, we all know about ensuring that every ward within the country has a primary health care center. This is to bring these interventions closer to the people. For areas that do not have primary health care centers or are far or hard to reach, the government looks at ensuring that health workers go to these areas, and this is where we implement outreach programs. And this is usually done on a weekly basis. So they take the immunization closer to the caregiver so that the children can get immunized. Another key focus is ensuring that these vaccines are potent and they're actually available at the last mile. And this is where UNICEF really supports greatly in ensuring that vaccines are available in a potent form, and they're being transported to cold stores very close to where these interventions are provided. Another thing that we also ensure is improving demand for immunization. And this is where a lot of our social mobilization activities ensue. And we work very closely with our community structures to improve demand for immunization. So we work with the traditional leaders, religious leaders, market leaders, and all that. And even the youth as well is a huge structure that we work with, because they are our change agents, to be honest. So we work with them and just wanted to see how we can improve demand for immunization services. And so these are just a bit of what we are doing as UNICEF to support the states. And we've been seeing a lot of improvement, but there's still a lot to be done. And we continue to put effort into ensuring that every child is reached with immunization services.
I have been speaking with Dr. Ijeoma Agbo, UNICEF health specialist, on the recently released Mix 6 with focus on maternal, adolescent, and child health. More to come in a moment.
You know this moment. Well, forget all that. Get out on that skateboard from 10 years ago. Break out that lucky bat. Do that. Do it badly, do it awkwardly. Do it your own way. The point is, get moving. For you and your health. Yeah, that'll do it.
It is still Sound Health on Lagos Television. UNICEF health specialist Dr. Ijeoma Agbo shared her expertise on the recently released Multiple Indicator Cluster Survey 6, also known as Mix 6, and with special focus on maternal, adolescent, and child health. So major disruption that happened in the last 2 years was the pandemic. How do you think states, the country, can act or perform better with regards to future pandemics to avoid disruption?
COVID-19 definitely was an eye-opener into the disruptions that can come if we do not plan for outbreaks. Most likely we'll still have other outbreaks in different forms in future years. So that is why we need to prepare and have plans in place, mitigation plans in the event that other outbreaks of that sort come again. And so ensuring that, we do not get into the issues we had before. So this is one thing that states are doing to ensure that they have contingency plans in place, vaccines are in place, and we have extra stock in the event that vaccines can't come in for any reason, or if there are lockdowns and all that. So those kind of plans are in place. Also in terms of planning with the states to ensure that we have health workers who are trained, IPC, that's infection prevention control measures are in place in health facilities to prevent spread of diseases. All that is in place. Just as I mentioned also in terms of outreaches, those are ongoing, and it's more or less institutionalized within the state, whereby even without outbreaks happening, we ensure that we go to all those areas where we notice they're low performing or it's hard to reach. Vaccines are taken there on a weekly basis. So this is something that stands whether there's an outbreak or not. So I think it's just ensuring that we plan better and we're prepared whatever might come out in the future.
All right. Let's quickly look at the maternal and reproductive health now. According to the survey, we still have about 21.1% early childbirth for children under the age of 18 years. How did we get here, and how do you think we can perform better in this aspect?
In terms of early childbearing, yes, Southwest, if you see, the Southwest scored much lower than what we have in the northern part of the country, which is much higher. However, looking at early childbearing, it was more or less to understand within childbearing what ages are we seeing, do we need to focus on, especially when it comes to antenatal care and ensuring that women have stillbirth attendants and all that. And we can see that across some of the states, especially like Oyo, we could see that it was much higher than the other states. What could have contributed? COVID might have contributed to that. Also in terms of education, in terms of those that are out of school and all that, we're seeing that there's a bit more in our girls. So that would have contributed to that. There's also the part when it comes to culture and the tribes as well that we're seeing, especially that are moving from other states into the Southwest. However, it just allows us to plan better, and to also look at what interventions we need to put out there. We need to do more when it comes to education. We need to do more when it comes to raising awareness. If a girl is in school, she's more likely to make more informed decisions around, when to get pregnant, family planning, and all that. So it just helps us to plan better, and then look at what interventions we need to put and what messaging needs to go out there in terms of planning pregnancies, spacing pregnancies, and all that. So for me, it's not a cause for concern, even though it should be, but it just helps us to plan much better the interventions that we provide in our different states.
All right, let's look at contraceptive acceptance and usage. The world is about 8 billion now, and how do you think we can use contraceptives to check population explosion, looking at vis-a-vis this recently released survey by UNICEF?
Also, when it comes to contraceptive use, this is an area that we've been working on with the states to bring up, and this is along with other partners. We find out that the use of modern contraceptive is still not as optimal as we would like it. Of course, when it comes to starting your families or having children, and even spacing children as well, we still find that it's quite suboptimal. And with the explosion of the population right now, we definitely need to do more. We still have a lot of barriers, which is cultural, religious barriers, which we've seen have contributed to why women and even men do not use contraception. Also, there are lots of not just taboos, but fallacies around the use of contraception. So a bit more needs to go into our mobilization, community engagement, social mobilization messages that are going around. Another good thing that came out of this meet was the fact that we need to look at other more innovative ways of getting out messaging, aside from the traditional media that we've been used to. And we're now in the ICT age where a lot of persons are actually using social media to get out information. So we probably need to leverage on this to get information out on contraception, to not just married people, but even unmarried, our youth. It needs to start early to get that information out. And we're going to use not just our traditional ways of passing out messages with traditional media, using community structures as well, which is word of mouth, but also using other ways of getting information out on the use of contraception, the advantages, disadvantages of it, and all that, just to ensure that people have the right information, and we can allay some of the fears with the use of contraception.
All right, what would you like to see going forward in the states, in the country?
So going forward, as I mentioned earlier, this mixed survey is more like a scorecard for us to look at where we are after implementing and over the last couple of years. And so we expect that states will now go back, different MDAs will go back, look at their different areas, how they performed, and try and understand, really what is the reasons for, low uptake. If they've done well, understand what you've done better. If you haven't done too well, or if you stayed stagnant, try and understand the reasons for this. Do greater deep dives to understand what the enablers, the barriers are to some of the suboptimal coverage of some of these interventions that we're implementing amongst our caregivers and the population at large. And with this, we now sit down and refine strategies. So it's more evidence-based. Refine strategies that you can use to improve these identified gaps, and ensure that our activities are more integrated. We need to stop vertical programming whereby we're doing malaria, we're doing this, we need to start to integrate these programs and leverage on the strengths of each program to see that we gain more traction. And then as we're doing this, we need to continue to monitor what we're doing, continue to understand if we're improving, or there are things that we need to change, and going to support those out there on the field working to ensure that whatever they're doing is actually bringing about a change in our community. So I'm just hoping that this is definitely going to be used. It's not supposed to be kept on our desk or a laptop, but there are results that we're supposed to use to basically have more evidence-based programming when it comes to implementing on the field.
All right, that's for key players. What about members of the public? It takes two to tango now. We can't just make policies. How do we carry along members of the public?
So that's where you come in as well. So thanks for having this program, because then you're ensuring that you're getting the information out to the public around what mix is, as well as where we are when it comes to different indicators, especially when we talk about maternal, adolescent, and child health indicators. Understanding that we need to do a lot of work. So whilst we bring interventions to the community, we also would like to see them use these interventions. It's unacceptable that any child or any baby should die, any mother should die in pregnancy, any child should die. And it just takes the simplest interventions by accessing health facilities when they are unwell, getting them immunized to prevent vaccine-preventable diseases. Women should ensure that when they are pregnant, they go for their antenatal services, get immunized, with tetanus, because it will protect their babies. And then when they want to give birth as well, ensuring that there's still better time. So there's a lot that needs to be done. And it's with this information that is going out through you, thank you, that we continue to get the messaging out and continue to do all we can. Also to our community leaders and within the communities, also ensuring that our community members have the right information. So we continue to engage with them, and we're thankful for the fact that they're always open to listen to us and take those messages out to their communities to continue to utilize these interventions when it comes to them.
Dr. Ijeoma Agbo, UNICEF Health Specialist, thank you so much for your time and expertise on the program. We really appreciate you.
Thank you so much for having me.
All right, I have been speaking with Dr. Ijeoma Agbo, UNICEF Health Specialist, on the recently released Multiple Indicator Cluster Survey with special focus on maternal, adolescent, and child health. Soundhealth continues with trending health reports. Please stay tuned. It is still Sound Health on Lagos Television. More to come in a moment. It is still Sound Health on Lagos Television. This is where we say thank you on today's episode of Sound Health. Remember, maternal, adolescent, and child health are key in achieving one of the sustainable development goals in the country. All key players need to put all hands and resources in place to ensure this. For comments and inquiries, please send SMS to 08035826603 or follow us on social media at LTV Social. #Sound Health. A sound health is a sound mind. Make healthy living your choice.